Hey, good afternoon. Is everyone ready? Can you hear me okay? Hey, Jack, can you give me a thumbs up if you can hear me? Because you're the one I can see. Okay. All right. Thank you all. I appreciate your patience earlier in the scheduling this, and I want to just wish you all a good afternoon. I'm glad you're all joining me here today. The COVID-19 crisis is complex. We're facing fights on multiple fronts. Our primary focus initially has been, along with our Commissioner of Public Health, Dr. Mendoza, ensure Monroe County residents are safe, the needs of our most vulnerable citizens are met, and that all government and community leaders are working collaboratively to the benefit of all of our residents. And thus far, the community's response has been nothing short of remarkable. By working together, we have flattened the curve and are saving lives. But there's more work to do, not just when it comes to the diligence and care necessary as we consider how to slowly reopen responsibly, but also when it comes to the next fight in this COVID-19 crisis, dealing with the budgetary and economic impacts from the shutdown of the past several weeks and the continued restrictions that will be present in the economy going forward. So that's what we're here to discuss today. And so I'm going to share my screen, something I haven't done before, so you're going to have you bear with me one moment. Is my screen shared? Okay. Okay, we're having a little technical glitch again. It's not working. There we go. Okay, so we are here to discuss, and I wanted to give you an update on where we are related to the county's budget. And I wanted to talk about where we are, what we're concerned about, and what we're going to need to decide in the coming days, weeks, and months ahead. So here's what we know so far. The county's financial information that we have is through the end of the first quarter, March 31st, 2020. And just to remind everyone, we announced our first positive COVID-19 case on March 11th, announced schools were closed on March 13th, and then New York on pause went into full effect on March 22nd. So it's important to realize, and what these charts that I'm going to show you are going to show is that we don't yet have data to demonstrate the full impact of COVID-19. Because as I just said, we just started this just over a month ago. So as you can see, in the budget adopted by the county legislature last year, they budgeted both expenses and revenues from the general fund to be roughly $991 million. Based on the county's finances through March 31st, and in a world in which COVID-19 does not exist, our finance department projected that 2020 expenses would be in the range of around $966 to $958 million, and the 2020 revenues would be in the range of $970 to $971 million. That means without COVID-19, we were on track to have expected a budget surplus in the neighborhood of around 3.9 to 11.7 million dollars. So we were in a net positive position for Monroe County as we were projecting for the rest of the year. Now, obviously, what you're looking at as the projected expense and revenue, it's not a one-for-one relationship, because some of your expenses that you project, as you come in under expense, your revenues will also come down. If they're reimbursable revenue, there's a part of that. So after you account for those offsets, you have about a $3.9 to $11.7 million budget projection in the positive side. As you can see here, the general fund budget is made up of a number of revenue streams. And what you see on the slide are the revenue streams that develop over the course of the year that are related to the general fund. And this is what was, and you can see what the $981 $89 million in revenue and how it's apportioned between each of those various revenue streams. For 2020, the projected sales tax revenues of $158 million make up about 16% of the general fund revenues, just shy. And then you could see the hotel motel tax is just shy of $9 million, making up 1% of the general fund revenues. Various fees, including parks, parking, and DMV, is about 3%. State aid comes to around 20% of our general fund revenue. Federal aid 11%, property taxes 41%, and then other revenue streams roughly 8%. In 2020, because obviously we are not operating in a world, we have a projection, actually, we'll start here with the pre-COVID 2019. The $158 million that was budgeted in the first quarter of 2020, we brought in roughly $40 million in sales tax. And the sales tax is one of the most closely watched budget items for revenue that are coming in, particularly because of the economic slowdown that we've had. So the $40 million is what we had through the first quarter of 2020. The receipts for that actually represent a 7% increase over what the county received in the first quarter of 2019. So we were actually starting the year in the first quarter with a very strong year. And because we were starting off in a strong position with our sales tax revenue, again, pre-COVID-19, we would have been able to adjust what our expected sales tax revenues would have come in at to be around $162.5 to $165 million. But as we know, we're not operating in a pre-COVID world anymore. So now what we need to do is look through what are those revenue streams that we think are going to be most impacted by COVID-19. We know the impact is coming, but what we don't know is how big that impact will be. So what we've done is we've started to model the revenue impact, but we also need to acknowledge that we don't have all the data yet. As I indicated before, is when it comes to sales tax collections, through March, our sales tax collections this year were actually larger than our sales tax collections last year. The next time we'll be able to have a look at what happened post-March will come on May 11th when we get a look at where the April sales tax receipts are. So the best that we can do right now is project. And so what I want to show you is what I think we have in terms of projection and where we are at planning. I'll go back to where we were at budgeting, and we split this out into two different categories. The first is the revenue impacts related to tax collections and fees that we think are directly related to COVID-19. The other part we want to look at in COVID-19 is the state budget impacts, particularly around, and I'll go through what these are, the sales tax intercept for fiscally distressed hospitals, and again, the announced potential cut to state aid. Now, I'm going to give you just a big caveat to this. These, again, are projections. And again, like I said, we really don't know 100% certainty where we are, but this would give you an idea of the things that we're tracking. When it comes to sales tax, as I indicated before, it's $158 million is in our budget. If you budget between a 22 to 38% loss in sales tax revenue, which again, we'll have a better idea of this in the coming weeks, that could potentially set off a loss of $35 to $60 million to this year's county budget. The hotel motel tax, which again, I think might be a little more on the extreme cutback because of the reduction in folks who are staying in our hotels and motels, was roughly $9 million. And again, a 22 to 56% loss would be $2 to $5 million. And then in other fees and surcharges and things like that, we're talking about DMV fees, we're talking about fees for parks and other things of that nature. If you have a 30 to 52% reduction, that would be $8 to $14 million. So of the of those three categories of our revenue, which we think are the categories that are going to be most impacted by COVID-19, it's $194 million, and we think there could be a potential loss of between $45 and $79 million, depending on where we come in those projections and the losses. In addition to that, we are facing concerns relative to the state budget. And the state budget that was passed back on March, I believe on April 1st, it included a sales tax intercept for each of the counties upstate New York to fund a fiscally distressed hospital fund. We estimate, working with our partners at NISAC, that Monroe County share of that fund will be $3 million. And then in addition to that, of the $195 million that the state of New York provides in aid for various programs across the board to Monroe County, the governor has indicated, based on the adjustments that are being made on the state level, based on state revenues, that there's going to have to be adjustments made to state aid. And again, that's something that they're tracking closely and will track each quarter. But they've indicated that without additional federal support, it is likely that there's going to be a reduction in those fees. So we put in there a percent loss of somewhere between 10 and 20%, which, if that's the case, that would mean a $20 to $40 million additional negative value to the revenues. So on the state side, it's $23 to $43 million, which brings our grand total in impacts to revenue to $68 to $122 million. All right, part of our planning is going to be around how best to use the CARES funding that came from the federal government, and Monroe County received approximately $129 million. And with that money came guidance from the Treasury Department that explained how we can and cannot use those funds. And I want to thank Congressman Morelli, Senator Schumer, and Senator Gillibrand for their leadership in fighting for and obtaining this funding, which is also why we're not talking a lot about where county expenditures are now. If you refer you to one of the first slides I showed, that showed that we were operating in the black, and that is because the CARES funding that we came, if you look at the eligible expenditures, are largely allowed to be spent on things like medical and public health, costs associated with making tests widely available, hazard pay, payroll expenses for employees responding to COVID-19, and essentially COVID-19 related expenses. So COVID-19 has not had that impact on the expense side. It really has had that impact on the revenue side. Ineligible expenditures, you can see on the board, are expenses that essentially are not directly related to additional expenditures related to COVID-19. So what's going to happen going forward? Some of the things that we're looking at is how do we use the CARES Act money, and how does the guidance continue to change as we go through there. And many of our actions going forward are going to be conditioned upon additional aid coming from the federal government, either in the form of allowing us to use, hold on, I'm trying to get back on the Zoom. There we go. Now you can see me again. So many of our actions going forward are going to be contingent upon additional aid coming from the federal government, either in the form of guidance allowing us to use the $129 million to cover lost revenue, or additional money appropriated for the explicit cost of making Monroe County whole. Issues such as budget cuts and furloughs are tough conversations. And there's conversations that we have to start having, but these decisions are going to be made as we continue to get more data on the impact and information related to what we can expect from the federal government in terms of aid. I want to thank Congressman Morelli as well for his support in working through this effort and his sponsorship of legislation that would allow federal aid dollars that have come in terms of the CARE Act funding and additional aid that would come from the federal government to be used to cover loss of revenue that can be tied directly back to the COVID-19 crisis. Legislation like that would greatly impact counties like Monroe and our ability to square our budgets, and would help counties and municipalities across the state and across the country. But we also need additional federal dollars in terms of direct aid. And I could tell you right now that we're just at the start of this, but I promise that this is going to be a transparent, this will be an open conversation. This is really the start of this conversation. And the reason why I wanted to bring the public into this conversation about our revenues, about what we can be facing, is because without that additional direct aid from the federal government coming into the state to prevent those state funding cuts from coming through, and without additional federal support coming down into our municipalities to make our budgets whole from revenue, we're going to have to make some very tough decisions over the next several months. The other factor that's going to play a role in this is in how we open the economy and when we open the economy. One of our largest decreases in potential revenue streams is potentially from our sales tax revenue and our hotel motel tax, which are obviously directly related to how the economy is open and how quickly that can happen, but being done in a safe way that manages public safety, make sure that we're still continuing to save lives and flatten the curve, but when we can do that, open up the economy in a safe way. So with that, I can open it up to some questions. I think Julie Phillip is going to manage the questions.
Okay, we're going to start with Brian Sharp from the Democratic Chronicle, followed by Jennifer Lukey from News 10 NBC.
Brian, how are you?
Good, good. How are you? Good to see you.
I'm great, thank you. Nice to see you.
Was wondering what efforts are you taking efforts now to curtail spending, and can you talk about, if so, how much those are expected to be generating or be saving?
Yeah, as I said before earlier in the presentation, so we had started the year looking at our expenses very carefully, and had started the year right up until the COVID-19 process in reducing our expenditures. So our expenditures for the county had been down because we take a hard look at every dollar and penny that are coming out and looking for efficiencies in the way that we spend those dollars. So we continue to do that, and then additional expenses that were directly related to COVID-19 are reimbursable by the CARES Act funding. But what we have started is a process working with with my leadership team here to develop what those contingency plans will look like. We're just at the start of what that process would be because we're a little early in the decision-making process to be pulling the trigger on those, because we still aren't exactly sure what the revenue forecast would be, but it was important to have this conversation to set the context for what some of those hard decisions might look like.
And if I could ask a follow-up, I was wondering, there's a lot of talk about hiring basically an army of contact tracing folks. Can you talk a little bit about the resources being directed to public health, and if you are hiring additional people in that regard?
Absolutely. So it's something that we're working with our partners at the state on right now to figure out how we would meet those benchmarks. And there's two criteria that we're looking at. One is the fact that we do have contact tracers now. And this is something that Dr. Mendoza has talked about. We have a number of people in the Department of Health who, from the very beginning and from our very first case, call folks who turn up positive, who are tested positive, and they'll call, find out who they've been in contact with, and make additional calls and do that contact tracing. So I think that the work that the contact tracers in our Department of Health have been doing right from the beginning of this has gone a long way towards helping us to flatten that curve, and then also help to make sure that we're streamlining our testing to where it's going to be the most effective. Because when you can't test everyone, you have to figure out then who can you test. And I think that's why our testing has been so effective here. The other criteria, though, that we're looking at is that it would be very helpful that as we add contact tracers and try to follow the state guidance on that, that we try to hire local people related to that, because when you call someone and ask where were they and who they've been in contact with, and they give you the name of a local business, it would be really great that that contact tracer had some context for that and was aware of what that local business was. And so it's really good, and be aware of our geography and be aware of our area. So one of the things that we're trying to balance is how do we add people, but particularly local people. And it would be our understanding that those additional expenses that are directly related to COVID-19 would be expenses that would fall under the guidelines of the CARES Act dollars. So who was next? I'm sorry.
Thank you, Brian. Jennifer Lukey, you're
Jennifer.
next, followed by Dan Schratt from 13 Man News.
Jennifer, nice to see you.
Hi, nice to see you too, Adam. Thank you for taking our calls today.
You're welcome.
I'm wondering, I'm thinking everyone at home is probably saying, okay, this is going to boil down to two things, jobs and taxes, right? So if you can't find the revenue, how does that impact jobs and taxes?
Right. So if we can't find the revenue, it's two things. First of all, you can't tax your way out of a $100 million problem. So that's why additional support from the federal government is really going to be necessary here. And you see this conversation taking place on the national news between the House, the Senate, and the White House. I am a optimist by nature, but we still have to operate in the real world, which is why we put these projections together, and we're going to start planning for the worst. The White House had sent out a tweet I think it was about last week, indicating in their negotiations with Senator Schumer and the Senate that there would be a deal forthcoming to help municipalities on revenue, but we still haven't seen that yet. And obviously, that legislation has not passed, but we're hoping that the commitment by the White House and leaders in Washington will help us in the next couple of weeks. When it comes to jobs, though, a couple different things. The county budget, I think about a third of the cost of the county budget is personnel and benefits. There's a third of the budget is contract services, supplies, things of that nature. And half of the county budget, about $500 million is around social service programs, which are directly impacting the people who might be the most impacted by an economic downturn. So cutting those programs and cutting that personnel would really not be, is not an attractive offer, because it's going to have a real impact and make the conditions here worse. And so part of the problem that we're facing, and part of why this additional support coming to Monroe County, the state of New York, and all municipalities is so important, is because the programs that could potentially be cut are the ones that are going to be for people who are most impacted by this economic downturn.
I guess just, can you say at this point whether you're going to have to, whether you believe that you're going to have to lay people off or furlough them? And can you say to taxpayers, there's no chance we're going to raise your taxes? You probably can't say either of those right now, right?
Well, we're too early in the process to understand where this will go. But like I said, we have a property tax cap. You can't go over the property tax cap, even if you wanted to. And that's why I said you cannot property tax your way out of $100 million budget deficit. You just can't. You also just can't cut $100 million worth of staff. So there's going to be a long planning process to figure out what the right balance is. The county obviously does have some reserved funds that we're taking a close look at. But this is going to be part of the planning process.
Thanks.
You're welcome.
Next up is Dan Schrag from 13 Lamb and Patty Singer from Minority Reporter will follow him.
Hi, Dan. How are you?
I'm well, thank you. Thank you for taking our calls today. We appreciate it.
My pleasure.
So as far as that, the CARES funding goes, how much of that $129 million, roughly 129, is already earmarked, already spent, regardless of whether or not the county has received it, spent on COVID-related expenses? How much would there be left over, that is, to go toward making up this difference?
So far, we've spent roughly $10 million of the $129 million. And it's largely been made up of items, things like PPE, personal protective equipment, and things like that.
So if you were to get the okay, then to use this funding, that would be all right.
Well, it would have to be part of it's part of the plan. And it would obviously have to be part of the planning process, but that's tough to say, because you also, there's going to be additional expenses that come down the road, I assume, from COVID-19 as well. And that's part of the challenge that we're working through and planning through, is the fact that we managed to flatten the curve where we are now, and our expenses are largely around personal protective equipment. The county legislature, in a bipartisan manner, which I thank my colleagues in the legislature yesterday, approved hazard pay for our frontline employees. You have that now, but you also have to be cognizant of the fact that because we kept the curve so flat, we're also a community that could have that potential of a second spike later in the year, which again would come with costs associated with that. So it's not as easy to just say, well, if you have a $100 million budget surplus, you have $100 million left in care funding, your job is done. Our job's just getting started. You have to be able to plan this in phases and continue those advocacy efforts on why it's so important that the federal government step in. Congressman Morelli has been a great supporter and is championing legislation that would help us be able to turn this federal funding into a revenue for us. And Senator Schumer and Senator Gillibrand, I've spoke to several times over the last couple of weeks, are fighting for additional direct aid to local governments. And so I'm hopeful that that happens, and we're going to continue to talk to them about that and what our needs are going forward.
So the talk of budget cuts and furloughs, is that something that you're going to try and hold off on until you get to see April sales tax receipts on May 11th?
Yeah, we're not going to do any of those actions between now and then because it would be good to also understand where we are. It would be premature to make those type of stark cuts when we're this early into the budget year, and we also don't really have a good sense of what the reduction is. We have estimates. Various folks have done estimates. Economists across the country here in New York State have done estimates, but until you really get a look at it, it's hard. And we get to look at it every month. So like I said, on May 11th, we'll have a chance to see what happened in April. And that'll give us a really good idea, because the first quarter of the year, January through March, only really got the last 2 weeks of when we really had that shutdown in Monroe County. And even with those last 2 weeks, our sales tax receipts were again higher than they were at this point last year. So the economy here was strong, and the sales tax receipts were strong. So we want to take a look at what that looks like, have another look at what's happening in Washington, and then we'll make those decisions.
All right, thank you.
You're welcome, sir.
Thanks again. Patty Singer from Minority Reporter is up next, followed by Mary McCombs from Spectrum.
Hi, Patty. How are you?
Good afternoon. Thanks for the
Good afternoon.
So it seems like May 11th is going to be a big day, or around there, to see what the sales tax revenue is. There's been a lot of talk about how to open up the economy. If your revenue is very far down and it's concerning, and you want to try to open the economy in a healthy way, what is going to be your push to focus antibody testing in our area, so we know really if we're going to be prepared for that second spike, and we can begin to open up businesses for a variety of reasons, one of which is revenue for the county?
Sure. Well, the health and safety of our public is my top priority right now. And making sure that we manage the flattening of the curve and then not having a second spike is what's critical, because we don't want to overwhelm the healthcare systems and have far worse outcomes here in terms of fatalities and the spread of COVID-19. To answer your question, in terms of testing, I just was looking at some recent news about the efficacy of antibody testing. And it doesn't seem to me that there's actually still an antibody test that's 100% assured and reliable. And but we need to have more testing. And so, one of the things that we talk a lot about is how do we procure reliable, good antibody testing, but then how can we also expand COVID-19 testing so that if you're symptomatic, you can get tested right away and then know whether or not you need to be quarantined at home to prevent yourself from spreading it to somebody else. We have advocated to New York State for additional COVID-19 testing here. And just this week, I'm delighted that Governor Cuomo stepped up and stepped in here in Monroe County and provided us a new testing location. It opens tomorrow at MCC in the parking lot and is going to be able to do hundreds of new tests a day. And a couple good things that are related to that. First of all, it's easy. You have to make an appointment. You call 1-888 number that we can get you. But the other piece is that he also expanded the testing criteria to include all essential workers, including first responders who are asymptomatic. And I think that's important because those are the individuals who are most likely coming in contact with the general public and people who could be sick. And they could also be vectors of the illness themselves. And so being able to increase that testing capacity for them, I think will pay a lot of dividends. And so I think that by the governor increasing that type of testing in Rochester, it's going to make an enormous impact in our ability to manage opening in phases, which is what he said he wanted to do. And I just had a meeting this morning with Lieutenant Governor Duffy and leaders, business leaders from our region about this phased-in approach and opening up the economy. And I'm glad that it's going to be done in phases, because you may not know, if you open everything up right away, you may not know where that spike came or where we didn't do a great job in opening things. And so you do things in phases along with increase in tests, and we should be able to get things back open and moving again while also keeping people safe and healthy.
So as a follow-up to that,
Sure.
there's been concern as the weather's gotten nicer, people have gotten out, and there may be less diligence towards social distancing. A lot of the testing still seems to be geared to the frontline people, which should be, that's important. But as people are getting out more, maybe laxing their social distancing, what about testing for regular people walking down the street, and how important a factor is knowing those results when we start to think about opening up the economy, because we're the people who are going to be in these shops and trying to go back to the restaurants as well.
Sure, I think it's important. I think that we should be testing as many people as possible. But unfortunately, you can only have as many tests as you can have, and so you have to create parameters and guidelines about what's going to have the largest impact on public health and the economy. And so I think the approach that's being taken now is correct. The hospital systems and the Monroe County Department of Health are doing an enormous amount of testing based on healthcare workers and their contact tracing. And then you have Walmart set up a drive-through location about a week and a half ago, and the state of New York is setting up a drive-through location tomorrow at MCC, and the parameters then get broader. So the general public, they should be working through your primary care physician, and your primary care physician can order you a test if you're symptomatic and meet the criteria. But with these new testing sites, you can also sign yourself up through their websites to be able to obtain testing as well. And those results, by the way, are also funneled into our Department of Health. That was a public health order that Dr. Mendoza signed last week that requires certain parameters around testing to make sure that if you are symptomatic, that you do contact a primary care physician. If you don't have one, you contact the Department of Health, and that you quarantine at home until your test results come back, and that the test results make their way to the Monroe County Department of Health as soon as possible so that contact tracing can begin.
Thank you.
You're welcome. Mary, were you up next?
Followed by Kevin Okocha from Rochester Business Journal.
Okay.
Hello?
Hey, Mary, how are you?
Next. Okay, good. Thanks, Mr. County Executive, for taking our questions this afternoon. I know you mentioned you're waiting on a lot of data to get more specific with all of this, and in regards to the sales tax receipts, a better look at that in May. I'm just curious if you've had any conversations with any of the sharing partners as to what they might receive, because I believe, I'm not quite sure, correct me if I'm wrong, but the city's fiscal year will be starting up, I believe, June 1st. Just wondering if you've had any conversations with anybody else that is relying on this.
Yeah, well, Monroe County shares more sales tax revenue with its local municipalities, I think, than any other county in New York State, which is why we are a little less reliant on sales tax than some of our peer counties. I've seen reports coming out of other counties where they're already looking at revenue anticipation notes, and their budget revenue projections are far higher than ours. And I think that's because they're much more reliant on sales tax, because they don't share their sales tax revenues with the towns, villages, schools, and cities as we do. So ours is a smaller percentage. So I know everyone's looking at that. The city of Rochester put its budget together, but the other piece of that is that when you talk to city officials as well, they're on a different budget timeline as us. So decisions that they have to make are going to come a little earlier in the year than decisions we have to make, because they're in their budget process now. Our budget process won't come until later in the year.
Okay, my follow-up question would be, we talk about the second wave, and I know right now you're dealing with the impact for 2020, but challenges ahead and what impact this pandemic will continue to have for next year's budget, which will probably be here in the fall.
It will, and those are the challenge. And the challenge is going to be, again, it's going to be around revenue and how you project and what the impact on the economy is going to be. And the challenge that we're gonna have is the fact that largely by and large what county governments do is we provide services to people who are really more impacted by a downturn in the economy. And so this is going to be a very difficult budget cycle to go through when we have to make those tough decisions, because we have people who are reliant on food stamps, temporary assistance, support services like that. And we also provide a lot of soft, you call them soft mandates, where it's sort of like, it's a service that we should provide, but maybe not necessarily required by law to provide. I look at my public health department, my opioid plan that we just passed through the county legislature, again with bipartisan support last month. And again, I'll thank my partners in the legislature for working on this issue. That's something that's not a true mandate in the sense that it could be cut, and that's not something I want to do, because, and those are the tough choices that you make, because again, that could impact people who are more severely cut by that downturn, or more impacted by the downturn in the economy. There's a lot of preventive services that we do that help prevent people from going into the system, going into a welfare system or public service system, a public benefit system. And so we really want to avoid making those cuts, but those are the tough decisions we have to make, and those are going to be the priorities that we're going to have to work with our partners in the county legislature on to figure out what are going to be our priorities going forward. And also the piece of this, when you talk about a second curve or a second wave, is then that changes your economic outlook, your long-term economic outlook, because your decisions are going to be made differently if you think a 1-year blip and a 1-year economic downturn, whether it's related to a sales tax, hotel motel tax. They're gonna change at different times and different rates and open up differently. If you have a second spike in November, December, that's going to be a real serious problem going into the following year, because we're going to have a whole nother shutdown into the following year, which we want to avoid. So that goes back to my first point, which is you have to get the public health side right, and you have to get the reopening right before you rush to fill budget gaps, because with revenue, and just think solely about sales tax. Because if you're just thinking about sales tax, so we have to open so we can fill these revenue gaps, what you're going to do is you're going to create another revenue problem in the fall when you have that second spike, because you open too quick. So you have to do this in a slow, methodical way, a phased in approach. But we do have to get open again. So we have to figure out, how do we do it safely, right? There is a safe way to do a lot of the things that we all want to do, but we have to identify that, have industry standards, start to open it, and we have to increase testing. So I'm grateful the state did the increased testing, and I'm grateful too that Bob Duffy has been appointed to lead this region. Like I said, I was on a call this morning. There's a lot of great ideas. And hopefully those are implemented in a safe way so we avoid that second spike.
Thank you.
You're welcome. Kevin from the Rochester Business Journal.
And then Jeremy will be standing by from City Newspaper.
Okay. Kevin, are you there? Do you have any questions?
Why don't we go ahead and
Okay, so we'll go ahead with Jeremy Moule from City Newspaper.
Thanks. This sounds to me like you're saying it's a revenue problem and not so much an expenditure problem. Is there a circumstance that could happen where it becomes an expenditure problem?
Well, I suppose it depends what happens if you have a second, third, or fourth spike throughout the year. Right now, we haven't really had an expenditure problem because the CARES Act money reimbursed a lot of those expenses. So there really hasn't, we really haven't had that issue, but I guess it would remain to be seen. The one thing I'll point out though, Jeremy, to your question, is that county budgets and state budgets operate a little bit differently than perhaps the federal budget does. Our budgets have to balance. So at the end of the day, there has to be a big zero at the bottom. Your revenues and your expenditures have to balance. So a revenue problem then at some point becomes an expense problem, because you have to be able to square those two columns.
And then it also sounded like you're looking for more flexibility with that CARES funding. I basically, I got the impression you'd be able to use it to offset some of that revenue loss if things were changed.
Yeah, I would like the ability to be able to do that. And obviously we look for efficiencies in our expenditures in other areas of the county budget, which is why the first quarter of the year, we were coming in our view, projected to be under budget on our expenditures. So we're going to continue to look for ways that we can cut costs and reduce costs, but having the flexibility to be able to use that funding to make up for revenue gaps would be very helpful because it would help our ability to be able to provide and continue to provide these services that we provide to folks who are most impacted by the crisis.
Okay, thank you very much.
You're welcome.
James Brown from WXXI and Sabrina Mattiori from WROC should be standing by.
Hi, James. How are you?
I'm well. I'm well.
Good, nice to see you.
Nice to see you too. More on the CARES funding, what can you spend it on and what can you not? Were there current guidelines?
Yes, so they released guidelines that I believe we got last Wednesday night or Thursday. I saw them Thursday. So they just released these guidelines about a week ago. And the guidelines are essentially, they're fairly broad in that you can spend them on costs and expenses directly related to your response to COVID-19. So whether that's personnel costs, that's equipment costs, whether there's economic development program costs. You could also spend those funds. So it's pretty broad, but it has to be directly related to COVID-19. What you cannot spend the funds on is costs that you otherwise had budgeted, and you cannot explicitly, right now, you cannot spend it to recoup lost revenue.
Thank you.
You're welcome, sir. Sabrina.
Hey, it's going to be me from Channel 8, Jack Watson here.
Oh, I'm sorry, Jack. How are you?
No worries. I'm good. How are you?
Great.
Good. So my question here is, given the social distancing constraints, how can local leadership, how can you encourage some more local spending to happen, given the fact that many businesses are closed and given the fact that one of the biggest chunks of revenue that you'll be losing right now is sales tax? How can you encourage local spending?
Well, I think it's by working with Bob Duffy and industry leaders in the governor's office to create and look at safe ways to be able to do things to help people be able to move back out. You know, I look at the way grocery stores are being managed, like Wegmans, or Tops, or Aldi's. You walk in, you're wearing a mask. The employees are wearing a mask. You're standing 6 feet apart in line to check out. A lot of the locations have one-way aisles, and they've managed to be able to operate in a way where it hasn't caused that big spread. Right? We still have managed to flatten the curve while still keeping grocery stores open, liquor stores are open. And so there is a way to do it safely. And so what I would say is what's important then is to, it's not about encouraging the public to continue to go out and spend money. That's not exactly what I'm thinking. The way I approach this is how do we work with industry leaders to create that plan to be able to open up additional sites in phases, additional parts of the economy, but do it safely. Learn lessons from the essential businesses that are open now and what worked and what didn't work, and then be able to do that as quickly as safely possible.
And what do you foresee a plan like that looking like?
Mm-hmm. So it would look like a phased-in approach. We've had indications that hopefully on May 15th, first round of openings may occur related to manufacturing and construction, which I think is a good place to start. And then from there, I would anticipate probably an every couple week expansion and look at being able to add additional businesses to that list. Or types of industries to that list. And I think it's wise to do it in a phased-in approach. And the reason why is because you're not necessarily going to know the impact of the open right away. The disease has a 2-week incubation period, and then from there, you know, you start to develop symptoms, and then from there you end up impacting hospitals. So there's a several-week delay from when you may have more community spread, and then to actually be able to see it. The spread. So to be able to open in phases is the right approach, because you can open your manufacturing and your manufacturing construction sectors you can have them open with safe guidelines, parameters. Then a couple weeks goes by, we don't see that second spike, things are going well, you can open up that next phase. Okay.
We're gonna go back. Kevin Club just says he was beginning to.
Oh, sure. Kevin, I'm sorry we missed you earlier.
I was talking to myself. I had myself muted. So I apologize. My question, I'm just curious. I mean, do you see any way the federal government can't help counties and towns, cities out? That, I mean, how dire do you see the situation?
Well, it's going to be a problem across, but it's not just here, it's across the country. And that's why when you see, to be honest with you, you see some folks in Washington say, well, we'll bankrupt the states, or go ahead, we'll bankrupt the local governments. That's irresponsible. And the reason to say that, because the reason why is because local governments, and I, obviously have a personal or a particular look at this because I'm the county executive and I manage a county finances. But the county government provides an awful lot of services. We don't exist for the sake of existing. We exist because we provide social service programs. We provide transportation programs and services, and these are things that make us go. And these are the safety net programs that keep, that help people who, ironically, are most impacted by what's happening. And so it's not as simple as saying, well, we should just bankrupt a state or bankrupt a county. That's going to create problems 10 times, 20 times the problems that we're seeing today. So it's irresponsible. So, we have some great partners here in Rochester with Congressman Morelli, Senator Gillibrand, Senator Schumer. We've had some great bipartisan conversations amongst our local government officials. I speak to them almost every day, but we have a conference call every day that puts them all together. Like I said, the White House tweeted something out a couple weeks ago, so I think there's some flexibility there. But this will be a significant problem, not just here though, but across the country if we don't get additional resources.
Thanks, Al.
You're welcome, sir. Was that everyone? Okay, so I think that was everyone had a chance. I appreciate you all joining us today. I look forward to continuing this discussion in the weeks to come. And again, I would just make sure to again follow up and encourage folks to continue those social distancing practices. I know we're all getting, there's some fatigue setting in. We're getting tired and anxious to go back to normal, and we're looking to get back to the old normal, but we need to, but in order to do that, we have to make sure we continue to keep that curve flat. So I appreciate the community. I appreciate all the essential workers who are keeping us going, particularly those frontline workers, the doctors, the nurses, all those in healthcare, those who are working inside our nursing homes, my county employees, the thousands of workers who work for Monroe County are doing a fantastic job. Those who are working in grocery stores all over, and all the essential businesses. So we should all say thank you and do our part to prevent, to slow the spread, to keep them healthy and safe. And we'll come through this together at the other end. So thank you all very much. I appreciate it. It's nice to see you.